Hello everyone. Welcome back to Learning with Suji. In today's biology lesson, we are going to learn about tuberculosis, TB, one of the most important bacterial diseases affecting humans. In this video, we will cover the causative organism, mode of transmission, symptoms, diagnosis, treatment, prevention, and some important exam points in a simple and easy to understand way. So, if you're a school student, college student, or a biology enthusiast, this video is for you. Let's get started and learn all about tuberculosis with Learning with Suji. Tuberculosis is a contagious bacterial disease that mainly affects the lungs. It is caused by the bacterium Mycobacterium tuberculosis. TB spreads from an infected person through tiny droplets released into the air when they cough, sneeze, or speak. Common symptoms include a persistent cough, fever, night sweats, weight loss, and fatigue. Tuberculosis is preventable and curable with early diagnosis, proper treatment, and vaccination. The causative organism of tuberculosis is Mycobacterium tuberculosis. It was discovered by Robert Koch in 1882. It is a bacterium, prokaryotic microorganism. It is rod-shaped, bacillus, in appearance. It is non-motile, meaning it cannot move by itself. It is non-spore-forming. It is non-capsulate. It is an acid-fast bacterium because of its waxy cell wall containing mycolic acid. It is an aerobic bacterium, so it grows best in oxygen-rich tissues such as the lungs. It multiplies slowly by binary fission, which is why TB develops gradually and requires long-term treatment. Tuberculosis spreads through the air from an infected person to others. The bacteria are released when an infected person coughs. TB can also spread when an infected person sneezes. Talking, singing, or laughing can release tiny respiratory droplets containing the bacteria. People nearby may inhale these infected droplets, leading to infection. The disease spreads more easily through close and prolonged contact with a person who has active pulmonary TB. Crowded and poorly ventilated places increase the risk of transmission. People with weak immune systems are more likely to become infected after exposure. TB does not spread by shaking hands, sharing food, or touching clothes or other objects. Early diagnosis, proper treatment of infected individuals, and covering the mouth and nose while coughing or sneezing help prevent the spread of tuberculosis. Symptoms of tuberculosis. A cough lasting for more than 2 weeks is the most common symptom. Some patients may cough up blood or blood-stained sputum. Pain or discomfort in the chest, especially while breathing or coughing. A low-grade fever, particularly in the evening, is common. Excessive sweating during the night is a characteristic symptom. Unexplained and significant loss of body weight. Reduced desire to eat, leading to poor nutrition. Persistent tiredness and weakness even after adequate rest. Shortness of breath may occur as the disease progresses. In some cases, especially extrapulmonary TB, the lymph nodes become enlarged and swollen. Next we are going to see about diagnosis of tuberculosis. The doctor asks about symptoms, recent exposure to TB patients, and medical history. The doctor checks for signs such as persistent cough, fever, weight loss, and swollen lymph nodes. A sputum sample is examined under a microscope to detect Mycobacterium tuberculosis. The bacteria are grown in a laboratory to confirm the diagnosis. This test is highly accurate but takes several weeks. A chest X-ray helps detect abnormalities in the lungs caused by tuberculosis. Tuberculin skin test. It is also called Men2 test. A small amount of tuberculin is injected into the skin to check for a TB infection. Blood tests, IgRA. Interferon gamma release assays, IgRAs, help detect TB infection, especially latent TB. These tests rapidly detect TB bacteria and can identify resistance to rifampicin. A CT scan may be used when detailed images of the lungs or other affected organs are needed. A small tissue sample from an affected organ or lymph node may be examined to confirm extrapulmonary tuberculosis. Tuberculosis is treated with a combination of antibiotics to kill Mycobacterium tuberculosis. The first-line anti-TB drugs are isoniazid, rifampicin, pyrazinamide, and ethambutol. Treatment should begin as early as possible after the disease is diagnosed. The standard treatment usually lasts for 6 months or longer. Depending on the patient's condition, medicines must be taken regularly and exactly as prescribed by the doctor. Patients should never stop treatment early, even if they start feeling better. Directly observed treatment, DOT, helps ensure that patients take their medicines correctly. A healthy, balanced diet and adequate rest help improve recovery and strengthen the immune system. Patients should attend regular follow-up visits to monitor their progress and identify any side effects of the medicines. Most patients can be completely cured if they complete the full course of treatment without missing doses. BCG vaccination helps protect infants and young children from severe forms of tuberculosis. Cover the mouth and nose with a tissue or elbow while coughing or sneezing. Wear a face mask when caring for or being near a person with active tuberculosis. Maintain good ventilation by opening windows and allowing fresh air to circulate indoors. Avoid close and prolonged contact with people who have untreated active TB. Wash hands regularly and maintain good personal hygiene. Seek early medical care if you have symptoms such as a persistent cough, fever, or unexplained weight loss. Complete the full course of TB treatment to prevent the spread of infection and the development of drug-resistant TB. Eat a balanced, nutritious diet and maintain a healthy lifestyle to support the immune system. Screen and test close contacts of TB patients so infections can be detected and treated early. That's all for today's video on tuberculosis. I hope this lesson helped you understand its causative organism, mode of transmission, symptoms, diagnosis, treatment, and prevention in a simple and clear way. If you found this video helpful, please like, share, and subscribe to Learning with Suji for more biology lessons and educational content. If you have any questions or suggestions, feel free to leave them in the comments below. Thank you for watching, and I'll see you in the next video. Until then, keep learning with Suji.